guys, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be talking about clinical prediction rules and their roles in research. Let's break it down. Let's first talk about the definition of what a clinical prediction rule is. Please disregard the two different colors. My red marker ran out of ink a little bit through, so just ignore that. So, what is a clinical prediction rule? It is a tool that contains the best combination of individual components from history, physical examinations, and/or laboratory tests that can help the clinician make a diagnosis, establish a prognosis, or select the appropriate treatment. So these are very important because we as clinicians, and especially physical therapists, which is what I'm studying, we have so many tools in our toolkit, and oftentimes when we have an evaluation, we just simply do not have the amount of time that it would take to perform all the different tests and measures that we know. So by having a clinical prediction rule, this really breaks down that process. Let's next talk about the purpose of clinical prediction rules, which we kind of already got to in the definition. Doesn't that blue marker look so much better? So, like we previously stated, efficiency and accuracy, right? So we have so many things that we can do as physical therapists, but clinical prediction rules allows us to be more cost effective. It reduces the variation when we're performing our evaluation and helps us to be more efficient when we're performing our evaluations. So instead of taking hours and hours to perform an eval, we can really cut that time down. We can also reduce variation in practice. So how I practice or how another physical therapist will practice, it's really going to reduce that variation between different clinicians as we're all going under the same guidelines, something that has been tested over and over and over again and has proven to be accurate. Like I previously stated, it's a lot more cost effective, helps to reduce all of the resources that we would normally put into an evaluation, and lastly, it does simplify the process as well. Let's next talk about a great example of a clinical prediction rule that is used widely in practice. So an example is the Ottawa ankle rules. I have made a previous video on this, I believe it was a few months ago, so if you're curious to learn more about these, scroll back on my page. But in short form, the Ottawa ankle rules allows us as clinicians to quickly rule in or out a foot fracture and determine if a patient needs to be sent off for a radiograph or not. Now, this is very important, especially in the use of like an emergency department, because instead of spending hours and hours and hours on our various tests, we can go through and say, oh, yep, they have this, check, check, check. They should be sent off for a radiograph. It looks like they have a bigger probability of having a fracture in comparison to it being another issue. There are three main steps when we're developing a clinical prediction rule. The first one is the derivation study. So we're piecing together the predictors, we're forming the rule, and we're looking at this in comparison to small samples or subjects. The next step is the validation study, and this is very, very important. So the big thing we're getting at here is, can this be reproduced, right? So we're looking at more independent samples, and ultimately we would want more than one validation step in validation studies to help support this upcoming and new clinical prediction rule. And the last one, of course, is the impact analysis. So how is this going to affect clinical outcomes? How is this going to affect efficiency and cost in the future? And how is this really going to transform how we're performing these evaluations? Let us next talk about the study designs that are beneficial when we are developing a clinical prediction rule. The first one is prospective cohort studies. The second one is a cross-sectional study. And the last one is our randomized controlled trial studies. Especially this last one, the randomized controlled trial studies are very beneficial when we're in that validation stage. I hope you guys learned a little bit about how to develop clinical prediction rules and the purpose and role when it comes to clinical outcomes and how we perform evaluations. Come back to my page to learn more.